There's a springtime ring to have a friend right in your corner. Your heart will feel a little warmer. Tender loving care, tender loving care. Each warm and friendly touch lets someone know you care so much. Tender loving care, tender loving care.
Good afternoon. I'm Dr. Greenbrier Almond. Thank you for joining us on our program, Tender Loving Care. Each week on Channel 3, I'm happy to talk about this interface between Christianity and medicine. And today I'm going to be talking about children and children's health. And of course, I want to remind you of the Jesus admonition, let the children come unto me, for such is the kingdom of heaven. Children are very precious, and God watches over them in special ways. And of course, as serving on the school board, I'm not speaking for the school board, but serving as a member of the school board, I am aware of children's health and measures that we take in our community to keep our children healthy. So today I'm going to be talking about just some preventive measures that we do, and maybe some things we could do in the future for our children to be even healthier. School is underway. We started in the middle of August, and now here we are at the end of September, and school is well underway. We'll probably even be having the first quarter grades soon. That seems almost impossible, but things go by so quickly. But in my role over the years as both a psychiatric physician, practicing neurology and psychiatry, and then also as trained in some family practice, and actually ended up being president of the American Academy of Family Physicians in the state of West Virginia for 1 year. I've always had an interest in preventive health, and I think that that's where the money is. If we can prevent a disease, then we're much better off than treating a disease. An ounce of prevention is worth a pound of cure, the old saying goes. So when I came across this article, this is from the American Academy of Family Physicians. I've been a member for over 40 years, 45 years or so. This is the August issue, 15th of August 2016. This reminder to doctors about the preventive measures for children. I thought it'd make a good program to talk about sometime like today. And I'll talk maybe why we do these things and what we're looking for as we try to prevent disease. Well, first of all, most children now are born in hospitals, and that's a good thing from the standpoint that almost immediately we can do some of these preventive tests while the child is still in the hospital before they go home with their mother and father to the home life, and we know, have some idea about the degree of health of the child even before they leave the hospital. However, if a child is born at home, or the child is on the way to the hospital and the baby comes early, then these tests surely can be done within that week or two of birth in the newborn period. Some things that we still find valuable to screen for is congenital hypothyroidism. It's a screening test, a blood test, and the thyroid gland is in the neck. It's a little smiley face, if you want to say it that way, shaped gland, and it controls the metabolism of the body. Children need to have an active thyroid so that they can actively benefit from their mother's milk and then later other nutrition, so they can thrive, as the saying is. And we have a syndrome called failure to thrive, when a child seems not to be gaining weight, not to be doing well. And then we may screen for a lot of diseases, but one of them that we want to know up front is the thyroid gland. It has two hormones, and it's T4 and T3. This is thyroid 3, thyroid 4. The numbers imply the amount of iodine in the hormone. hormone is a messenger. It's a little protein messenger the body makes. And so it sends signals throughout the bloodstream, again, controlling the rate of metabolism and how the body uses food. So it's a good screen to do. Hearing loss screen is something we do. And I remember a little fright, maybe when our oldest granddaughter was born in Michigan. It was an excellent hospital, and they screened for hearing, and she didn't hear as well as they expected. And so they, of course, checked the ears and then found there was fluid, maybe collected as the mother gave birth. My daughter gave birth, and the fluid was there. And just like you could be in a swimming pool or underwater and then come up and you could, or take a shower and turn your head a certain way and get the ear filled with water. So it turned out to be fluid, but the test was pretty good. And we knew right away that something was wrong. The ears were cleaned out, the child was tested again, everything was okay. But if you think about it, a lot of how children learn language, and of course, whether it's mama or dada or whatever word they say up front, it begins because they hear the sound around them, and they're repeating sounds, and they're watching their mother's lips, and we now have 4 granddaughters, and I've observed that the younger ones now learn fast because they're listening to their sisters talk, and that's okay. That's a good way to do it. But hearing is very, very important, and it's an important screen to do. Another screen for newborns is ocular gonorrhea. Now, this seems hard to believe, but this is the way we are in America at this point. But common cold is common. We all get the sniffles perhaps 6 times a year, and that's pretty common. And now if a child starts to have a lot of infections, then we look for immune problems and reasons for that. But one of the things we screen for is gonorrhea, ocular gonorrhea. If the baby's being born through the birth canal, and there's going to be a chance that they've been exposed to whatever's growing there, then gonorrhea is one of the things we want to screen for. Ocular gonorrhea, because a child could go blind, and we don't want that. That's another major deficit for a child to live with the rest of their life, and it can be treated with medication. It used to be penicillin alone, but there's combinations of medications that we use to treat gonorrhea. But I wanted to say gonorrhea is now more common than the common cold. So we screen it over and over and over again when we're checking out children and young adults and even older adults, of course. So gonorrhea is very much with us, and alarmingly, some gonorrhea strands are not easily treated anymore, and that is a big problem for the future. Phenylketonuria, PKU, is a inborn error metabolism. A child could end up retarded if this is not caught, and then the diet has to be changed so that there's not PKU in the diet, so the child doesn't get the phenylalanine building up and causing brain damage. And so you want to know if the child has that, and that's a urine test, not hard to test, but very vital to do. And we have probably about 22% of our population now is black, Afro-American, and a lot of people also have various degrees of black in them, and maybe even those from the Mediterranean and other places, Asia sometimes, can have a sickle cell anemia, a sickle cell trait, and that can be screened for too, should be screened for, because if the red blood cells, which carry oxygen to the brain and throughout the body, are not able to live as long as they need to, 120 days, and then they're replaced, then the child will be anemic and then will not develop normally. So those are the screening tests for newborn. So if a mother or father, grandmother, grandfather, others watching this program are interested, they should be talking to the pediatrician of the child, or maybe the family doctor, or as they're born in the hospital, the obstetrician, and others who will be caring for the child in the newborn period and ask about these tests and see how the results are. Now, from 6 months then, and a child is seen routinely, they start to get immunizations, and those are also things we'll talk about, but not today. But immunizations are very vital. In West Virginia, they are required before a child goes to school, and the best way to start them is early in the newborn period, and then repeat it certain number of months, and then the child is caught up and ready to go for pre-K or kindergarten or certainly first grade. And but we'll not talk about immunizations today, but there are other preventive measures that we do with children. It's now agreed upon that a fluoride supplement is necessary for the health of the teeth. And so in Buckhannon, we have fluoride added to our water supply. I remember when I was a young man, it was not the case, and it was debated. It was debated whether fluoride should be added to our water supply, but my father included, and other doctors in town, thought that it was a good idea. About that time, Crest toothpaste came out, maybe the first one with fluoride in the toothpaste, and that was a good idea because fluoride is one of those elements that, when present, keep the enamel hard, make it harder to have dental caries, and help the child retain their teeth. And then, of course, the primary teeth fall out and then are replaced by secondary teeth. And those secondary teeth are also healthy if the child has fluoride. And it's, besides brushing and all the other, flossing and all the other things, use of fluoride is necessary. Well, you can, if fluoride is not available, or the dentist or the family doctor or pediatrician wants to do this, you can actually paint fluoride onto the teeth, and it will also help. And that would be varnishing the teeth, they say. Doing that from time to time is very helpful, right from the time the teeth are erupting, 6 months or on. From age 3 to 5, we continue to do visual screens of children. I have been surprised. I don't remember too many children in my growing up that had glasses, but more and more children have glasses, and we do the visual screen. We're more careful about it. Children learn, of course, again, by what they see, and it's vital for their development. A child from age 4 to 5 is going to learn as much in 1 year as a college kid will learn in 4 years. So they're learning very quickly, and they need to have good eyesight and not be visually impaired. So the screening usually takes place about age 3. My father in his office in Buckhannon, and then I was in the office with him, and my wife also as a pediatrician, 20 feet back from the door to the waiting room, we had the Snelson screen for the vision, and then 20 feet back we had a mark on the floor. A child or adult would stand there and then read that eye chart, and it was a primitive test, not as sophisticated as, of course, getting glasses or getting the vision exactly right, but it's a screen. I remember over the years as we did screens for Boy Scouts going to camp for the first time, and then football players getting ready to play sports, or other team sports that have physicals, we would do the eye screen as part of our screen. Over and over and over again, we screen for the vision. It's that easy, it's that vital to do. Start at age 3. School-age children should have tobacco counseling. West Virginia and Kentucky are two of the highest tobacco-using states in the Union, and it's a shame because it's addictive, and of course a child can start chewing or using tobacco at a young age, and this will become a habit, become an addiction. There's cancers that will develop later after 10 or 20 years of use, and all sorts of problems, tooth decay, various things. But I remember going on mission with the Upshur Parish House down to McDowell County, and this was my first experience years ago now, but with children chewing tobacco. Now I suspect it's happened in the county and other places, but I just didn't see it. I didn't know about it. And the children coming to me, the mothers, the grandparents, did not complain or say that their children were using tobacco. And of course we ask that as part of a history question when children come in. But it's important to start screening that like at age 6. And for us to know as doctors and teachers about the use of tobacco. Our schools are tobacco-free campuses. There is no use of tobacco on the school ground, within the school building, and children, if they had that habit, or even adults who might be with them, cannot bring tobacco onto the campus and, chew or smoke or whatever. This includes, of course, our football games on Friday night or other sports games. We are tobacco-free on our campuses. Lately, that's also the electronic tobacco devices that don't light up, but they still, people are inhaling nicotine-like products, and those are banned also. Children age 10, so like by second grade, third grade, fourth grade, in this age, we begin to screen for skin cancer. And I have appreciated, again, having granddaughters, seeing that they are using their sunscreen, their parents are using their sunscreen all the time when we go out for a walk, go play in the park, certainly swim, then the sunscreen goes on. And my wife and I, in our old age now, use sunscreen every time we go out in the sun. I have a skin cancer removed from my nose, and in fact, this October I will go back for my yearly skin exam because having one skin cancer, I could have others. And this is clearly, in my case, from the use of being out in the sun too much as a little boy, which I greatly enjoyed, and swimming in the river and the swimming hole and the swimming pool in Buchanan, and just being out in the sun all the time without protection. Skin cancer has become the leading cancer of young people. And so by 10 years and older, kids need to be screened for that skin cancer, and they need to use a sunscreen. It's a sad commentary on our condition of childhood now. Children are not innocent. They hear too much, they see too much in violent form of violence or anger or war, all those things. And so by age 12, kids need to be screened for depression. Suicide has become a leading cause of death of adolescents and college-age kids, and it's ahead of violence. Violence is another way that kids die young. It's alarming that in places like Chicago, they're setting a new record this year for murders, and it's alarming to me that sometimes innocent children are being killed. They just are indoors. They're not even in a danger zone, a fire zone or anything, but stray bullets and so forth are killing kids in Chicago and other metropolitan areas. So saying all that, violence and use or the idea of depression or suicide also need to be screened for. And these are simple questions about asking directly, have you ever thought of suicide? And of course maybe asking about death or exposure to death, or the copycat phenomenon that you see now with children. If one child at a school does something, then how about the other children? They may feel that the taboo is no longer there, that they can go ahead. And even in our community, we have had young people commit suicide. We've had others needing treatment for depression. And in my time of practice, over 43 years or so, I treated a lot of children for depression. Actually, we now know, and it depends on the doctor and the mother and father and the child and the family, of course, but we now know that the use of the antidepressants may not be that beneficial for young people. In adults, it does make a difference to take an antidepressant, but there are other therapies, talk therapies and restructuring life and working with the home and so forth that will help a child who is depressed. And that needs to be a screen that we do, beginning at age 12. Again, a commentary about our life and the way kids live. We need to be screening for sexually active adolescents. And there even there's HPV virus vaccine that boys and girls get when they're about 12 or going into their adolescence. We are screening for gonorrhea in young people. And this is, again, more common than the common cold, harder to treat because of mutations and changes. The gonorrhea bug is getting ahead of our penicillin. There's chlamydia, another infection, actually some 37 venereal disease infections that we screen for now. A child should be screened at least for 2 of these, gonorrhea and chlamydia, if they're sexually active. And of course, this is hard to know, but sometimes in a doctor's office, then, and this is the way that I've approached it in my practice, I would ask the safest person to ask the child about their sexual activity, and that usually would be a female aide. If it's a little girl, and not necessarily the mother or the grandmother, not necessarily the male doctor, but a nurse or a female aide could be asking that question as say, a child's preparing for another part of their exam, and they would answer that truthfully. Children will answer truthfully. And so the screening can take place, and then it can be noted, and then there can be other questions asked. But we're screening for gonorrhea and chlamydia now in sexually active adolescents. Adolescents are increased risk for HIV. We believe that this is an underreported disorder in our society. It was treated as a different disease. Sometimes the medical record was separate. When I was practicing at the VA, we had that as a separate record, and just as we had addictions as a separate record. And it has advantages and disadvantages. It certainly protects the identity of the person who may be having HIV or whatever from being discriminated against by other healthcare workers. Certainly, it was the law of the land, so we kept separate records. However, it may be that someone with HIV was not known even to family members. And so now we screen adolescents, and this is a condition we're into in our society. As we get toward college age or going to camp, summer camp, or even joining a sports team and showering in a locker and maybe sharing a towel, whatever may happen, in a dressing room, swimming pool, school, gym class, whatever, we start to screen for hepatitis B. Certainly eating after someone in a cafeteria who might have hepatitis might spread hepatitis through saliva, things of that nature. So we're screening for hepatitis B in children that may be at high risk. And that might be all of us, the way we live. And there are vaccines for hepatitis B, and those need to be given sometimes before they get into college or very far along in their growth and development. Well, there's a lot more we could talk about. I wanted to mention this, and I won't be able to say everything today, but this is to bring up a dialogue in the terms of tender, loving care, caring for your children, caring for their development, preventing some horrible diseases from getting a hold in the child's life. The 2 main group of doctors who take care of children, pediatricians, of course, children's doctors are pediatricians, and then family doctors who also take care of a lot of children. They're more and more agreeing with each other on these screenings. There's been variation over the years, but they seem to be coming together now, and they are screening each of these diseases I mentioned. Some other things, autism, seems like 1 in 100 children, 1 in 150 children, variations on how common autism is. Maybe that's something that could be screened. They're still open for discussion about that. Drug addiction, use of marijuana, I mean, all these things could be screened for, but it's not clear now that that's the case. Remaining a moment here, I want to talk just a little bit about changing football rules, because as a member of the Board of Education, we have become interested in concussion injuries, and football, along with other sports, are where concussion injuries take place. Some things the American Medical Association is saying about that is, if there is a concussion injury in a sports event, the child needs to be out for 4 weeks. It's not 1 week or 10 days and go back in. Just like orthopedic injuries, major strains and sprains of muscles, child may be out for 4 weeks. So it is with concussion injuries. The reason we're so interested in this is because we now know through the chronic traumatic encephalopathies that can develop that children can become demented, and therefore then they can't go on and learn, and can't go on to college and careers that they would want to go forward in. They may become depressed, they can become suicidal. These are complications, and so 4 weeks out, if they're, and then the child cannot go back in and play the game until they've been cleared by a neurologist or someone well-trained to screen for some type of concussion injury and then how the child's doing. Other things that suggested is a child may not want to line up with head-to-head lineup because those promote head trauma. If there is going to be contact, it should be twice a week only, not every day. If there's a practice going on, at least as far as contact. If there's going to be contact on any particular day, it should be 20 downs, 20 opportunities for plays, not more than that. It doesn't mean there can't be a lot of other exercises, but not the contacts that may lead to concussion injury. Suggested in some cases that the face mask be painted differently so that the official can see clearly at the ear level or above if the head is being hit, because sometimes the official's watching a lot of things happening and they need, of course, to be careful, or the coach or other people watching this. Well, there could be a lot more to be talked about in concussion injuries, and I just want to emphasize that as we get into our sports, and I'm so glad that both males and females are involved in sports. This is something we want to do a lot more exercise, and team sports teach teamwork and, of course, how to win, how to lose, but we want to be aware of concussion injuries, particularly in sports like football. Well, until the next time then, this is Dr. Greenbrier-Allman thanking you for joining us on our program, Tender Loving Care. Special thanks to Channel 3 for this opportunity to come your way each week and to talk about vital issues of tender loving care. We hope to see you next week.
Stories of a West Virginia Doctor, written by Dr. Harold D. Allman. A collection of 55 short stories about his experience as a small-town doctor in central West Virginia. And Tender Loving Care, Stories from a West Virginia Doctor, Volume 2, written by Dr. Greenbrier-Allman, using videotapes to write 70 additional stories of his father's very colorful life as a small-town doctor. They can be found for purchase at Amazon.com and most local bookstores. Tune into Channel 3 Buckhannon for Tender Loving Care with Dr. Greenbrier-Allman, where he talks about the connection between Christianity and medicine.